Hi guys, thanks for tuning in. It's me, Ellie Hale, doing a webinar this time about why it's time to care about mental health in the workplace. It's just me flying solo today, so I'm going to do a lot of talking. What I found out when I was researching this is, to be honest, we could easily have made this 2 webinars or 3 webinars, so it might be quite a long one today. But what we're going to do is perhaps next month extend this. So if there's anything specific that you wanted to know about, or if there's anything that we can help with or do research for or present in our next webinar, then please do email in and let us know. Okie doke. So we've been quite overwhelmed by the response of how many people wanted to tune into this. It's been quite well timed. Obviously a subject at the forefront of everyone's minds, especially with all the coverage that's been in the press this week, with mental health being the cause of up to 300,000 people losing their jobs per year, which is just the most obscene figure. I couldn't believe it when I heard that. So according to Charity Mind, approximately 1 in 4 people in the UK will experience a mental health problem each year. In England, 1 in 6 people report experiencing a common mental health problem, such as anxiety and depression, in any given week. And there is still so much stigma involved in accepting mental health, especially in the workplace. Business in the Community, who have done a study with YouGov, said more than 3/4 of the 20,000 workers aged 16 to 64 who took part in their study said they had experienced symptoms of poor mental health, and nearly 2/3 of those with mental health problems felt that work was a factor. So we're just going to open this up to a poll because I just want to kind of try and gauge what you guys reckon. So of those 20,000 people in the study who disclosed their mental health to their employer, how many of those said their employer took no action? Would you say 10%, 25%, 40%, or over 50%? So if you guys just want to answer what you reckon. What are people saying? The majority of you guys reckon over 50, but about 30% are saying 40, 10% are saying 20, and 5% are saying 10. Okie doke. Well, in that report, published on the 4th of October by charity Business in the Community, in partnership with YouGov, it found a shocking lack of employer awareness and responsiveness. More than half of the employees who disclosed their symptoms of poor mental health said their employers took no action. Only 22% of managers that were surveyed said that they'd had training in spotting and supporting employees who were struggling. And most managers, at 63%, felt that they felt obliged to put the interests of the organisation above the well-being of team members. So, mental ill health is now the leading cause of sickness absence in the UK, with more than 15 million absence days attributed to stress, anxiety and depression in 2013, at a cost to the UK economy of 8.4 billion. The Centre for Mental Health has also calculated that presenteeism, which I think companies are definitely getting more aware of, so that's the practice of staying at work more hours than required, because although you're at work, you're not really contributing, you're not really doing your job as you should be. Usually, because of job insecurity, costs the UK economy 15.1 billion per year. So it's clear this is a major problem, and one that companies, managers and workplaces need to accept and be aware of and act upon. So Emma Mamo, who's her head of workplace wellbeing at Mind, said in response to this YouGov and Business and Community survey that it brings into sharp focus just how far we have to go when it comes to raising awareness and tackling stigma. It's horrifying that almost 1 in 6 employees who disclose mental ill health face dismissal, disciplinary action, or demotion. Good workplaces aim to create a positive culture where staff feel they are able to talk openly about issues like stress and mental health, and know that if they do, they'll be met with support and understanding rather than facing stigma and discrimination. Forward-thinking employers recognise the benefits of recruiting and retaining a talented and diverse workforce, including people who might be experiencing a mental health problem. 1 in 6 is a statistic that I was personally shocked by. I couldn't believe it. I guess not everyone is lucky to work for a company that supports you when you're in trouble or when you're struggling. There's obviously a lot of work that we need to do. So Martin, I'm not quite sure how I say his surname here, Martin Seligman, who is the father of positive psychology, had done a report and gave a TED talk a few years ago. And he theorized that while 60% of happiness is determined by our genetics and environment, the remaining 40% is up to us. And that consists of knowing what your highest strengths are and using them to belong to and in the service of something larger than you are. And his quote is that satisfactory lives are founded by the simultaneous pursuit of meaning and engagement. So when you consider that we spend the majority of our lives at work, it's our colleagues that we spend more time with than our families, knowing your value at work is important, and feeling as though you are achieving and that those achievements are recognized is key to happiness at work. And for those of you that are suffering from a mental illness, what can you do to help yourself? I mean, really basically be kind to yourself, practice self-care, speak to people and ask for help. Advice from the Mayo Clinic is that there's no sure way to prevent mental illness. However, if you do have a mental illness, you can take steps to control your stress, to increase your resilience, and to boost low self-esteem, because that might help keep your symptoms under control. So if you pay attention to warning signs, if you work with your doctor, and you learn what might trigger your symptoms, and make a plan so you know what to do if your symptoms return, and contact your doctor or therapist or counsellor if you notice any changes in how you feel. Also, consider involving your family members or your friends to watch out for warning signs as well, and that counts for colleagues too. Get routine medical care, so don't neglect checkups or skip visits if you have a counselling session or you're going to CBT or mindfulness, especially if you're not feeling well. Get help when you need it. So mental health conditions can be harder to treat if you wait until your symptoms get really bad. Long-term maintenance treatment might also help prevent a relapse. And take good care of yourself. Have enough sleep, eat well, and take regular physical activity. That's all important. As well as sticking to a regular schedule, and chatting if you're having trouble sleeping, or if you've got questions about diet or physical activity, you can go and see your doctor. And what about, I guess, which counts for a lot of the workforce, you're not diagnosed with a mental condition, but perhaps you're feeling particularly overwhelmed and stressed. So have a think, can you guys identify with any of these? Do you eat on the run or in a disorganized manner? Do you smoke or drink excessively? Are you in a rush and hurry? Are you always trying to be available to everyone? Do you do several jobs at once? Do you miss breaks? Do you take work home with you? Do you feel that you've got no time for exercise and relaxation? If you do, then maybe you need to take stock and slow down. Maybe have a chat with your manager at work, see if there's another way of doing things. And how can you combat workplace stress? So slow down. Focus on what you're doing right now. You can't meet deadlines by panicking about them. And identify the causes of your stress, so take some time out to think about the source of your stress. If you're feeling under too much pressure at work, don't just ignore your feelings and plow on. Talk about it. Help takes many forms. The solution might be simpler than you think. And know that you're not alone. Things can start to feel very lonely when you're stressed. You might feel like you're the only one holding things up, and that if you break, everything will crumble. But remember, you're not really alone. Help is out there, and you only need to ask for it. So, as an individual though, maybe away from the workplace, what can you do? Just do more of what makes you happy. Make time to exercise. I literally hate it, but I know that if I do, my mental health is a bit better. So I literally have to drag myself out for a run on the seafront. Hate the whole 45 minutes that I try and do 5 kilometers, but afterwards I know I'll feel a bit better. Spend quality time with family and friends. Make an effort to enjoy hobbies, especially when your mental health can be, you know, affected. If you're feeling a bit dark, it is a real effort to enjoy hobbies, but really try and keep doing the stuff that makes you happy. Try and think positively and practice mindfulness and meditation. Eat well and healthily. Try and sleep well, and try not to drink too much, and talk about your concerns and worries. Okie doke. So, the legal bit. According to the Health and Safety Executive, employees have got a duty to take reasonable care of their own health and safety and of others that might be affected by their actions. So, employees should inform their employer if they feel the pressure of their job is putting them or anyone else at risk of ill health. Suggest ways in which work might be organised to alleviate the stress. Inform their employer if they're suffering from a medical condition that appears to be long-term and is affecting their ability to carry out day-to-day tasks, including memory and learning, and discuss any reasonable adjustments that could be made to assist them in performing their job. There's been a culture shift in the way that mental health is viewed in the workplace, with employers prioritising mental health at work. It's in the best interest of everyone to do so. We know that employers who put in place measures to promote well-being at work, such as flexible working hours, employee assistance programs, and subsidised gym membership, companies that do that will reap the benefits and the rewards when it comes to having more loyal and engaged staff who are less likely to leave or need time off. Other things you could do, the cycle to work initiatives like we do at Posturite, healthy food options at work, have an open door policy, do more team building activities. Sometimes feelings of isolation at work or not really belonging can lead to mental health problems and stress. So, you know, really encourage your staff to get engaged with each other. Perhaps start a mentoring initiative. Make sure that you praise your staff, make them feel valued, appreciated, boost self-esteem, and promote a culture of openness and support. That doesn't just mean from an employee management level, but from peers as well. Try and make your workplace somewhere where colleagues will say well done to each other and appreciate each other. So, how to lessen the stigma at work. Ensure staff know about any stress awareness or well-being policy. Do you have one in place? Have HR got involved with it? Does everybody know that there is somebody that they can talk to? Talk openly about mental health, because if it becomes a common topic that is talked about by, you know, managers that you admire, by the directors of the company, it won't feel so strange if you ever need to ask for help. Educate yourself and others. So offer training to managers and all staff on what to look for. If there are any changes in behaviour to perhaps a member of your team or a workmate, look for changes in behaviour, look for work patterns, so you can spot it in yourself but also in others. Be conscious of the language that you use at work as well, so don't belittle your staff. Don't use mental health conditions as an adjective. And choose empowerment over shame. Support your staff, encourage them. Speaking out is brave and should be acknowledged if someone's asking for help. Be honest about treatment. So, moving on to law and mental health in the workplace. So, the Health and Safety Executive estimates that 9.9 million days were lost to work-related stress, depression or anxiety in 2014, 2015. Employers have a legal duty to ensure that employees are provided with a safe working environment. This means taking reasonable care to prevent personal injury, including mental health or physical harm that may in some cases arise due to workplace stress. The Court of Appeal set guidelines and employers' obligations in the leading case in this area, which was Sutherland versus Hatton. Case law indicates that no one occupation is to be regarded as intrinsically more dangerous than another to an individual's mental health. Courts will consider whether a stress-related injury was reasonably foreseeable and whether the employer took appropriate remedial steps to address the issue in line with its duty of care when they've noticed a potential stress-related illness. Turning a blind eye is not therefore an option. And further case law, so in J versus DLA Piper, LLP, EAT, lots of letters there. That makes the distinction in the eyes of the court between a low mood that is caused by work and clinical depression. And that kind of highlighted that employers, especially those that are in high pressure environments like the legal and financial services, that react negatively to a job applicant that has disclosed a history of mental health, leave themselves wide open to potential disability discrimination claims. And in Murray versus Newham Citizens Advice Bureau, a volunteer at the CAB was refused training on the basis of his mental health, and the appeal was upheld in his favour. The discrimination was because volunteer training could often lead to full-time positions, and they shouldn't have denied him that right. The 6 key principles contained in the HSE management standards for work-related stress encourages senior leaders and HR teams to assess and manage the demands placed on employees, allow employees some control in how they carry out their work, provide support, promote positive relationships, ensure employees understand their role in an organisation, and manage organisational change. And at board level, to monitor factors that might suggest there's a problem with stress-related illness for the business. For example, if there are high rates of absenteeism, staff turnover, poor performance, or conflict between staff. Ensure that there is a health and safety policy that addresses the issue of stress in the workplace, including, if appropriate, a stress management strategy. Ensure effective risk assessments have been carried out and are monitored regularly, and any recommendations are being implemented and adequately funded, and plan for stress-related risks when embarking on significant organisational change. So how to train, assist and assess your staff. Offer training on stress management. Assess your staff. Offer mindfulness training. Have an open door policy. And train managers on what to look for in their staff. Put posters around at work. You know, that if you see something, it becomes familiar. We've got a great one, which is 10 ways to combat workplace stress. It's free. You can just pop it up around the workplace. We have it around our office, and the follow-up email that I'll send out, I can include that as an attachment. We also, on our website, we've got one on productivity, which talks about stopping multitasking and working flexibly, and exercise, which is available in the resource section of our website. We also have our stress awareness course, Feel Right, which is becoming by far the most popular course after our DSE assessment, because companies are recognizing it's the #1 reason why, well, it's becoming the #1 reason why people are off work. So that offers training on the causes and effects of stress. You can say what your company is doing, and also what can the individual do to look after themselves. You can also have an assessment tagged on the end, which can be as in-depth as you want. You can go down to the specifics of, you know, I know what's expected of me at work, never, sometimes, always, often. Or it can be as simple. Some of my clients just literally say, do you want to talk about this further? And that's just opening the door and starting some discussions about mental health at work. So, as always, we would love to know what you thought of this webinar. If you wanted us to go into any more detail about any of the aspects or anything that's been mentioned in the press, then do let us know. As I said, we've got the opportunity to do a second webinar on this next month. I think what we've covered today really just highlights that communication is the key. And if your staff ask for help or suggest or are giving signals that they might need it, that as employers, as managers, we need to be acting on it. Let me know what you think and contact us if you need any more information. I hope you guys have a super weekend.